just now. Don't worry, the joke, it takes 3 seconds for the translator. I'm Adam Pellegrini. I'm the General Manager of Fitbit Health Solutions. I'm honored to be here today. We have partners actually in the audience. I'm very thankful. I love coming to Tokyo and meeting with our partners. And Mitsubishi is speaking tomorrow on some amazing work they're doing with Fitbit as well. So make sure you stick around and help 2.0 Asia to see their talk tomorrow. Also, thanks to Help 2.0 for doing this. I mean, I have been doing this since the early 2000s, I think it was. And it has continued to be the sustained momentum of keeping things really real in this industry. And so I'm very thankful for it. So what is Fitbit? Raise your hand if you know what Fitbit is. Okay, thank you. I just wanted to make sure. Fitbit has been around for over 10 years. The mission of Fitbit for 10 years has stayed the same, to make everyone in the world healthier. And it's fitting because we are at a global meeting, and we're going to talk just a little bit about what we're doing. But here's what I think all the gray hair that I have has come from. I have chased the dream of trying to get consumers engaged in health and then driving meaningful health outcomes at scale using technology. I won't use any buzzwords, but for again, over 10, 13, 14 years. I came to Fitbit because people like wearing the Fitbits, the brand they love, and I saw the opportunity of connecting an enjoyable experience to a health platform that could actually do the things that we all know work. And if you do it the right way, leveraging data and insights on that data, you can actually do it more efficiently. So Fitbit has, over the last 10 years, has over 7.5 billion nights of sleep, 9 trillion minutes of heart rate data. That's a lot of data. And it just doesn't sit there. We use that data to create insights in our experience, in our app, on our device, and now on our health platform, to help drive meaningful health outcomes and behavior change. So Fitbit has done really well on the whole wellness side, right? People get out, they get healthy, they walk, they do steps. I spoke to a CEO the other day who said, I thought Fitbit was just something that I wear to do steps and walking challenges. I had no idea that Fitbit is going deeper into healthcare, the other side of the equation. And one thing that's important to note, it is across all ages. It is something that is for everyone. So if we can move people and meet their needs on the wellness side, but also start really tackling problems like type 2 diabetes, hypertension, sleeping disorders, mental health. That really is the powerful, deep, meaningful things that we want to be doing at Fitbit. And if you think about something, take diabetes, for example, type 2 diabetes. You know, just the pure fact that we want to get people ambulating, right? Getting out there walking, but taking it beyond walking, the right prompts at the right time, with a coach or virtual care manager, those are the digital therapeutic. I'll say it once, but I don't know if I'll say it again. But that's really the concept of combining streaming biometric data into a health platform that has behavior change at its DNA. So, and we'll talk a little bit about that in a second, to actually drive health outcomes. Now, the neat thing is, those buzzwords that I just used are steeped in scientific evidence base for the last 20, 30 years plus. If you look back in the 70s and 80s, people have been talking about behavior change probably way before that, and interventions around ambulation. Those are things we know. So do what we know, but do it at scale, make it enjoyable, and use machine learning and other elements to make the care more efficient. Now in Japan, we launched Fitbit Japan in 2015. It's currently the leading health and fitness wearable in Japan, 63% of the market. So it's quickly becoming something that's very popular here. And again, through our partners, we have a very heavy partner strategy. And they're, like I said, sitting in the audience right now, and we're thankful for them. But it's a small but mighty team here, and it's an area of focus for us in the next year. So Matt mentioned Twine Health. Now, in the US, many people know about Twine Health because of Health 2.0 and other events. Twine Health was an acquisition we made about a year ago. We rapidly brought that into Fitbit, integrated it into our app, into our devices, so that the consumer experience, the fun stuff, the engaging stuff, mapped with this really steeped in evidence-based health platform created out of MIT Media Labs by Dr. John Moore, who is now our medical director, who is incredibly passionate about using technology, data, machine learning to drive behavior change at scale. If you put all of those, as Matt said, pieces together, that's the ingredients, that's the recipe for, call it whatever you want to call it, but a true patient, consumer, employee, health plan member to healthcare professional, care manager, coach, virtual care. That is the equation for driving behavior change at scale. So now what do? Now we take our wearables and connect it to this health platform. We take our other digital interventions, so we have other programs that we have created, and curate them onto this platform and provide health coaching and virtual care through health plans, through employers. Over 1,700 employers now use Fitbit Health, with over 6.8 million patients or employees or health plan members connected. A Fitbit to either our solution or a partner solution in population health. So very, very powerful. And I think I'll close with just a couple of things. 3 takeaways. 1, getting the consumer engaged is, in my experience, has been the hardest part of my career. And making sure that we think of how do we put the user, the consumer, the me in the center, that's a critical piece, and it can't be underestimated. 2, regardless of buzzwords, if you use these large sets of data in the right way to create insights, to create efficient care, to create, on the consumer side, enjoyable experiences, that's how you can create the synergies that are necessary to launch a large-scale health intervention. And then 3, distill it down to the most simplest form. Create seamless experiences that just you don't have to think about. I walk around with this. When I come to Tokyo, I probably walk, I think, 6 to 7 miles a day. And get up really early because I think I wake up at 3 in the morning sometimes. And I just go out and walk, right? I don't think about the fact that I'm tracking all this stuff. But when I go to sleep at night and wake up the next morning, I can see my biometric experience, and it actually makes me want to keep on hitting my goals. That's the don't make me think part. And if I have a virtual care manager or a coach on the other side also giving me other motivation and other kind of tips, to me, that is the way of creating something that people will use at scale that's efficient. So thank you.
So we just have a few